Good evening, everyone. This is a very exciting session, and I'm sure that we'll be benefited by discussion on this particular topic on digital technology, which is influencing our life like anything, especially in the COVID scenario. In fact, when we started from Cardiological Society of India, introduction of the digital technology in our conference, we never thought that the things will come so soon. And in fact, we were discussing about telemedicine and all these aspects, but due to the COVID scenario, everything has been hastened. So my topic today is increasing role of digital technology in cardiovascular disease management. And with this, actually, I would like to tell you that there is a gradual increase in the influence of the various technologies. Possibly one day will come, we'll not use, in fact, it has already come that we are not going to use stethoscope anymore, and clinical history will be given by digital format, and we'll be diagnosing everything with the help of various tools. And you can see that even with the the MR, you can pick up whether there is an evidence of or there is a possibility of the CAD or not. Similarly, the volumes of the heart can be also picked up by the CT angio, and cardiac scar can be taken up by the mapping, and you can see, which is being frequently used by Dr. Khanna for seeing the various parts of the the peripheral vessels, especially the aorta and the distal bifurcations. So all these can be actually seen, and not only seen, they can be demonstrated. And these are actually basically parts of the digital technology, which have gathered so much of momentum that we can't follow. Also, we can't understand also that there is real influence of the digital technology. But what is my proposition is that despite significant strides in our ability to diagnose and treat cardiac disease over the past half century, you see the leading cause of death, and especially due to acute myocardial infarction and sudden cardiac death, is still high. And there are various causes why it has happened like that. But if we use the digital way, possibly we might increase the longevity of the patients and decrease the morbidity. So that's where the role of the precision medicine comes as compared to the evidence-based medicine. And this precision medicine is basically dependent on the various digital technological advances, including the artificial intelligence and augmented intelligence. And you can see there is a huge gap, knowledge gap between the evidence-based medicine and intelligence-based medicine. And possibly that is going to be the future in catering service to our community. And what are the bricks and mortars? These are augmented or artificial intelligence, blockchain, Internet of Things, 3D printing, 5G and 6G, they are coming very soon. And of course, the quantum computation. And these all together will cause the smart cardio ecosystem, and ultimately they will be put together. And in fact, behind the screen, there are so many other aspects which are going simultaneously, like mathematical formats converted to statistics, and then data mining is there, data analysis is there, deep learning, machine learning, and all these are components of the artificial intelligence with the help of computational science, which is surging like anything, especially with the introduction of quantum computation. It will change the whole scenario. It can calculate the things, mathematical expressions much faster, almost 10,000 or 20,000 times more. Now there are different names of this: assisted or augmented, autonomous, and of course the artificial intelligence. All these are types of artificial intelligence. I'm not going into the deep into it, but they are all assisting in our system. And this is the basis of actually, the programming versus the computation. And you first set up the rules. They are put as output and input, and they come to the computer, and they form actually new rules which are put into the data, and ultimately they, this computer, they generate their own data and own computation without following our commands to some extent. And these are some of the machine learning and deep learning techniques, like supervised learning, classification, then unsupervised learning, clustering, and generalization. These are all parts of the computational system. But what is important, that all these systems are incorporated into the medical early, and ultimately you can form a microchip. Say, for example, for coronary artery disease, you can form a microchip using 50 genetic risk variants, or sometimes it may go up to 50,000 genetic variants, and thereby one can risk code with the help of genetics. And they are actually giving a very, very sophisticated methods of genetic scoring for the coronary artery disease in terms of high risk, intermediate risk, and low risk, and they can be classified based on the chromosomal patterns and the various genotypings. And ultimately, you can actually pick up the patients, and you can take the help of the genetics to identify the patients and then give the treatment much early than it is anticipated now. And what are the advantages? That it does not vary over time with meals, drugs, genders, and it's a single test, and it is postulated that the heart disease will be eliminated in this century itself because of the paradigm shift in our concept of the medical practice, which is nowadays called the precision medicine. And really it is going to help in a different shape. And these are some of the things which are going in a very, very common way. And the use of mobile technology, the watch, and all these are biometrics, and all these are incorporated in the system. And once the warning system is there, they can be transmitted to our emergency system, and the doctor will be called, and ultimately the acute cardiac event will be picked up much earlier, and they can be taken up for the management right from the first medical contact, if they are having the systems of all these like watch and electrocardiographic assessment methodology, and of course the mobile technology. And that's how the application of artificial intelligence in cardiology is gradually increasing and increasing. And as you can see that over a period of last decade, it has been involved in medical imaging, altered reality, decision support, biomedical diagnostic, then drug discovery, digital health, wearable technology, and robotic technology. And all these are nowadays being used, and much more will be happening, as you can see over here. Now, what is a very interesting part? What is very interesting part in the whole exercise is that one can actually change the behavior of a person with the help of the digital technology and with the help of a simple computer or simple mobile. And you can actually subject the person for motivation, inspiration. You can advise the diet if the person is taking more carbohydrate or more cholesterol or triglycerides, and you can increase the physical activity by advising over this system. So it's a huge advantage by which one can really advise the patient digitally. And recently in June, this paper has been published by us in the Indian Heart Journal, which actually emphasized on the concept of Arogya Setu, which is basically based on the the artificial intelligence. It can track high-risk patient. Then it has already produced a national dashboard, which can be actually again incorporated or joined together with an international dashboard. And it has also produced a virtual chat box. And it can measure, actually it can measure, not yet now, but it can be incorporated with the artificial intelligence based diagnostics like SpO2, BP, and other facilities. And one can actually, if we work on this Arogya Setu, and if the government gives us the permission, we can work on the decision making and protocol making, so that everything can be picked up very early. And you can see that the diagnostics and therapeutics can be based on even based on the digital technology, which is being implemented in the form of the transthoracic echocardiography, and the ASD device is being put in the across the echocardiography. You can also watch the very inside of the heart, which is also being mediated by the digital technology. And yes, now same thing. The digital technologies influence is there even in CRT application, and measurements and follow-up and programming can be done. I'm not actually showing the video to save the time. And same way, even in complex lesions, you can take the help of the various devices which are based on artificial intelligence, and then they can actually pick up the the various parameters. And this is a device which has been put inside the ventricle, and they are actually showing the various parameters in the heart, whether the diastolic pressure is increasing or not, and that's how the things are being taken care of. And this is a slide to show the virtual reality, and one can actually show the inside of the heart, and you can go in the deeper into the system. So, you can see that the digital technology is actually influencing the cardiologists and cardiovascular system in a tremendous way. And as it is happening right now, it can help in education, teaching, personal branding, and last but not the least is the use of telemedicine, as you have been already told by the MCI, that one can use the telemedicine with the various kinds of apparatuses like the computers and BP machine and SpO2 monitors and all, and they can actually give benefit to the online diagnosis and medication advice. And this is to show that the online teaching can be done in the complex lesion, and this is to show that the digital technology has actually come of age, and the robotic PCI is being done in India for the first time in the world, and the PCI has been carried out just by the robotics, and that's a huge advantage. And these are some of the important issues. They can give us the alerts, diagnostic help, and they can give the information retrieval, image interpretation, and we can give the records to the system for mining the data, and also designing the treatment plans and management issues, and of course the precision medicine, which is the need of the hour to reduce the timing of the diagnosis and offering the therapy, and also opening the artificial intelligence-based ecosystem in analysis and healthcare systems. And these are some of the agents which have been approved by the FDA for AF detection, then ECG by the watch, and one can also have the chest X-ray analysis and echocardiography analysis automatically by the artificial intelligence. And also the flow of themes, frames, narratives, and different like-minded people can come together and offer the information to the nucleus, and they can actually go for the various issues in a very concrete way without being interfered with the various phishing methods and all. Now this is a new technique, teleporting, which is being talked about, and you can see that the person is here as well as here. And this is the video which is being shown with Sundar Pichai, and who is at a distance, and he's moving from place to place, and even the person who is having the machine, he can also manipulate it, and this is being shown here. I don't know whether the audio of the video is being shown or not, heard or not. You can,
You can't hear the audio.
yeah. So this is the teleporting. Now teleporting showed you that some devices are there, or computer-like things are there, which actually showed the person at a distance place. But that is also not the end of the story, and one can go for the the virtual presence with the help of the digital technology. And cybersecurity is an issue, but definitely we can take care of that. And my last slide is that doing good is good and doing bad is bad. And Bahujana Hitaya, Bahujana Sukhaya is our concept, and we have to manage our learning process. We have to learn, unlearn, and relearn the technologies. That will be a new form of life. Thank you very much for patient hearing.
Thank you, Dr. Das, for an enlightening thought. And definitely, we also see many very interesting AI applications, even in India, right, across the world, but even in India, like for example, what Apollo has done with AI CVD, cardiovascular disease risk score, and many other such applications in this space. So I think we have Mr. Justice Suri. He's an innovator in health tech and joining from USA. So Dr. Khanna, is he?
Yeah, he's the one, next one.
Okay, so he will be talking about the role of AI in cardiovascular disease